Hello, my name is Alexis Schoen, and I'm a registered dental hygienist. Today we're going to have a lesson on the periodontal probe, insertion, adaptation, and stroke. The objective of today's lesson is following this demonstration of probing on a typodont, the student will be able to demonstrate proper insertion and walking technique of the periodontal probe with a 95% accuracy. Let's start with probe insertion. Always use a modified pen grasp, just like we do with instrumentation. Forefinger and thumb at the bottom of the handle, middle finger on the shank, fulcrum ready to fulcrum, and land as you can see in the lower right picture. Probe adaptation. As with everything we do inside the oral cavity, we want to gently adapt the tip to the tooth. Keep in mind, healthy tissue is firm and tight, though in some instances, unhealthy tissue can also have a tight and firm quality to it. Unhealthy tissue is typically spongy, soft, and or loose and flabby. An angulation is about 10 degrees. If we remained straight, parallel to the crown of the tooth, we would have a lot of tissue trauma. A 10-degree angulation is necessary in order to insert subgingival and remain adapted against the tooth. Remember, that's about 1 to 2 millimeters of the side of the probe. When the contact is reached, tilt the working end. Typically, in most teeth, we have a contact where the two teeth meet. We can't go straight down into that area, as you can see, because the teeth are in the way. So what do? Instead of going straight up and down, we'll have to tilt slightly to get the tip of that probe into the area that we call coal, which is the bottom of the direct mesial surface at the base of the sulcus. So let's discuss the probe stroke. The first thing you want to remember is always you should start at the distal facial line angle. Once you're here, make sure that your probe is parallel to the long axis of the tooth. You want to make sure you have about a 10-degree angulation so that the tip of the probe is continuously adapted to the side of the tooth. Using short up and down strokes only 1 millimeter apart, you start to walk subgingival distal to the distal contact, where you will slightly angle the probe tip to reach the base of the coal. Once there, you may remove from the gingival pocket, come back to the distal facial line angle, then you proceed to walk 1 millimeter apart, mesiofacial to the mesial contact point, where you'll tilt and reach the bottom of that coal. Once the proximal measurement has been taken, you can remove the probe. Keep the probe parallel to the long axis of the tooth. If no adjacent tooth is present, you can dip straight in, keeping that 10-degree angulation to keep the tip adapted to the tooth at all times. Some things to remember. You always want to maintain the tip adaptation to avoid tissue trauma. Using light pressure at all times for minimal discomfort for the patient. Reach the base of all pockets. Keep walking strokes subgingival and close together, unless you're at that distal proximal contact where you may remove it from the pocket, reinsert at the distal facial line angle, and walk mesial. That's it for today's lesson on the periodontal probe. Next up in lecture is the periodontal chart recording. Thank you for joining me today. Have a wonderful day.